everyone, Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mama. Today we're going to be doing more Q&A on starting solids. First up, when is spice okay to add for a baby? I love this question. So my background is Pakistani. I have a lot of followers who are either Pakistani or Indian, and people who just generally know how to cook with spice. So they have questions about when they can introduce this to their baby. Well, rest assured, you can feel free to introduce this to your baby as soon as possible. The good thing about this is we know that children can get some taste of flavors even in the womb. Garlic, cumin, onion, we can all actually pass down small amounts of those flavors to baby when mom is eating them in pregnancy. So allowing your baby to be exposed to certain flavors is actually not a bad thing. I recommend it because honestly, if your baby is starting to eat solids, they're not going to necessarily love something that's completely bland. It's okay to flavor it. Now, where we kind of get into this, I guess, gray space, you could say, is salt intake. And that brings me to another question. So how do you regulate salt intake? Or what do you look at when it comes to sodium intake? So generally, you're asking me as a daughter of a nephrologist or a kidney doctor, is that I grew up not eating a ton of salt. And generally, most foods that we get from takeout or from restaurants or packaging is generally a little bit more saltier than something you'd prepare at home. So I recommend trying to offer baby home-cooked meals as much as possible. And this works out well whether you're doing baby-led weaning or puree feeding, is that if you're cooking something for the house, make sure you put some off to the side for the baby as well. But just generally, you shouldn't be salting your food too much. And as long as you stay within the recommended amounts by the American Heart Association, you should still be in a good place. Should you be refraining from salting your baby's food completely? Generally, I say somewhere before 6 months of age, I wouldn't be adding salt to baby's food, and I would just be conscious of, if you are feeding them table foods, how much salt is in that table food. After 6 months of age, it's not like you can flip a switch and that the kidneys suddenly turn on, but just know that if you are pureeing baby's food and you're making, let's say, a large batch of vegetables or some kind of protein or a soup or something, it's okay to salt it to how you would for your own family, still keeping into, the background, the American Heart Association's guidelines for salt intake. And then just think about that. Make sure you're also offering water with meals as well. How much of a puree should a baby eat? So I love this question. I generally have used these trays from, actually, I think it's a New Zealand company, but it's called Mummy and Bubby, and I have it in my Amazon account. I will try to make sure I have the link below in the show notes for my Amazon affiliate account. In my storefront, you can see which one it is, but I love these trays because they come in 1 ounce portions. And I recommend, if you are, let's say, puree feeding and freezing food, starting with 1 ounce portions, you can get out that 1 ounce, and usually it's okay in the fridge for up to 3 days after you defrost it. So even if baby just takes, a half ounce of it, which is about 15 mLs or a tablespoon, you can still use whatever's left over the next couple of days. How much baby should be eating? I don't think a baby is going to probably start out with, at 4 months of age, eating 3 ounces in one solid feeding. So start small. Even if you want to take half of an ounce or 15 mLs, you can water it down with, a little bit of breast milk, a little bit of formula, or even just a little bit of water. But just make sure that if baby doesn't eat whatever's in there, let's say there's formula that's thinned it out, that you discard that remaining food, because obviously formula should be discarded within 2 hours of conception. But totally okay to expect small amounts in the beginning, and then just make sure you're watching for cues. If baby's opening their mouth, still showing interest in wanting to eat, and then you can absolutely continue to feed them a little bit more. All right, I hope that was helpful. Make sure you give this video a thumbs up. If you have more questions on starting solids, make sure you ask them below, and I will try to do more Q&As in the future. Bye.